What's the point of having a coherent, rational model of addiction? What would the point be? My point would be not to be right. Although I like being right. This kind of feels good, right? My point is that I think that a coherent, rational understanding of addiction that's based in science can help ease suffering from this awful, destructive disorder. And I'd suggest that some models that don't do this create suffering. Okay, so addiction is a brain disease. BDMA is not a new designer drug. This is an acronym for the brain disease model of addiction. This is the predominant model of addiction for most scientists on the planet today. Brain disease model of addiction. You as 2016 educated people should have an idea about addiction's a brain disease, diabetes is an insulin disease. This is not far-reaching neuroscience. And psychiatrists are brain doctors and treat brain diseases. And so when I approach a person, of course, I have this in mind. Addiction neuroscience says that when you voluntarily take certain drugs, certain molecules, they change your brain and they change your mind. That's just a little model for thinking about that. Almost every addictive molecule has been shown to change your brain and to change your mind. Very powerful. Now, why should you want to understand how the brain works? Here's one reason. And why should you want to think like a shrink? In a 2016 survey, these are drug use disorders, that's DUD. They're very common. And when you talk about comorbidity, there were significant associations with depression, dysthymia, bipolar, PTSD, and PDs are personality disorders. So a significant number of people with drug use disorders have other problems, and these are brain-based problems. This is a Dutch survey saying the same thing. Anybody with a substance use disorder, a third had schizophrenia, bipolar, depression, anxiety, and other kinds of problems. So that's one reason psychiatrists are important in the treatment of addiction. But here's another reason. So this looks like a good saying. Peace comes from within, don't seek it without. But, you know, I like the expression, if you see Buddha in the street, shoot him. I think someone wise said that. So Buddha was wrong about this. I'll tell you why. If you have severe treatment-resistant schizophrenia, peace may come from an antipsychotic. For some of my patients with severe treatment-resistant depression, peace does come from Nardil, an antidepressant. So it's not accurate that all human misery comes from within. That's just not accurate in my world. Now, of course, addiction is the opposite problem, that you do an excessive look outside. So some of these sayings. Here's another reason you need to think like a shrink. One of the substance use disorders, opiate dependence. Experts say medication-assisted treatment is the treatment of choice. Period, end of story. Not explore all the options. That's what's recommended, some kind of medication-assisted treatment. Because if you look at the slide, and this is retention in treatment, the patients on buprenorphine, this is not a sales talk for buprenorphine, I'm trying to talk about science. Patients on buprenorphine stayed in treatment, and this curve comes into my mind when I see somebody with opiate dependence. Patients without medication, their time in treatment is whoop, and they're gone. And I guarantee when they drop out of treatment, it's not to go to some non-12-step based program. No, that's not what's happening when people fall out of treatment. So in order to understand this graph, which is the reality for opiate use disorders, you have to understand the brain. To understand this study, you have to understand the brain. Ultra-low-dose buprenorphine treats suicidal ideation. How is it possible that as a psychiatrist, I may be thinking about using buprenorphine to treat depression? You're going to understand that later today. How does naltrexone reduce drinking in teenagers? Naltrexone blocks opiates in the brain. How does that work? You're going to know by the end of our talk. That's another medication. And they studied heroin, and they showed that heroin helps people with emotional pain. That's no surprise to anybody. A speaker later today struggled with this for a long time. So to make sense of data like this, you have to understand how the brain works. God says, oh, that's what those are for. You never knew what halos were for, but actually. But this is to remind me, in 2020, you may go to a treatment program and be offered this. What is that halo? What is that thing? That's a TMS coil. So in 2020, it's possible that if your sons or daughters are going to treatment, I may say that we can modify their brain with TMS and that can help them. It'll probably look more like this. But how would that work if this is not a biological disorder, because TMS changes the biology of the brain. It's early. How do you make sense of this? That patients who had a stroke and this part of their brain called the insula died, see the red picture? Patients in the hospital where that part of their brain died quit smoking like that. How does that make sense if addiction is not a brain disorder? Or is that where God lives? I don't know. And then everybody has to make sense of this. This is very recent data from Ken Kendler, who's done these tremendous twin studies. Just focus on the black. How do you make sense of the genetic basis of addiction if it's a supernatural disorder? The genetic basis of addiction is because genes pass on molecules that affect the brain. Your risk for drug abuse was increased by 1.5 to 2.5 times if there was a biological parent. Didn't matter where you grew up. So all of these data help us think about addiction as a brain disorder. Let's talk about one-hand clapping. In 2016, this is Cognitive Tool 1, in 2016, our best understanding, my best understanding, and I'll have an off-counter debate with anybody who wants to go on about this, is all of our thoughts and all of our feelings and all of our wants and all of our needs and all of our hopes and all of our dreams come from the activity of the cells between your ears. That's the way the world works as I understand it. That's why when someone has Alzheimer's and their brain gets chewed up with these awful plaques and tangles, the person disappears, don't they? Slowly, but they do. That's why someone who has a severe stroke, you can look in their eyes and say they're gone, or some part of them is gone. Now, this is a really weird thing. One-hand clapping is, we clap with two hands, so this organ between my ears can be seen in two ways. It's this organ made of cells like my finger and my pinky and my toe, and it runs on chemistry and electricity. And on the other hand, and this is one of the most dramatic modern mysteries, I don't have an answer to it. These cells between our ears make thoughts and feelings and dreams and pictures and poems, and it's crazy. I don't know how it works. But the smartest people I know that study this thing say that it's parts of the same thing. Parts of the same thing. That's why I can play with your mind. I can change the way your mind works by chemistry and electricity and hormones and all that. Anybody who's been through menopause knows this very well, right? Or anybody who's gone through puberty. Anybody gone through puberty? You think chemistry changes the way your brain works? You bet it does. And so the reality of our existence, as I understand it, is that our conscious experience is created by the activity in an organ called the brain. That's step one in thinking like a brain scientist. It's a weird big leap, but it starts there. We're going to get into part two now. That's tool number one. Tool two is from about 10,000 feet. So let's say I believe what I just said, which I do, that all of your thoughts and feelings and all that is about this organ between your ears. I'm really interested in how that thing between your ears works now. Right? So we've spent a lot of energy and time trying to figure out how this thing between your ears works. And guess what? It's really complicated. That's why when you ask me any question about the brain when we're done, I'm going to take a deep breath and say, it's really complicated. That doesn't mean it's not true, it's just really complicated. So from how we understand the brain, everybody's probably heard this analogy. If you blindfold a bunch of people and give them an elephant, they're going to touch different things, and somebody's going to say it's a spear, it's a fan, it's a wall, it's a rope. And so I could look at the brain, and I will, and say, the brain's a really social organ. That's why meetings matter. If you ask me why peer support makes a difference as a scientist, it's because humans are a social species. Period, end of story. There's other parts to it. You can look at the brain as a chemical organ. That's why drugs change the brain, and that's why we treat some brain disorders with chemicals. You can look at the brain as a developmental organ. That's why when 18-year-olds use drugs, it's much worse than when a 25-year-old does, because the brain's this developing organ. So there's a lot of ways to understand the brain.